For this lab, we're working on the internal pelvis and genitalia, and for this particular video, we're looking at the pony specimen. So here we're looking from the lateral side at the pony, and we're going to turn it over and look inside the pelvis. So we're going to start on the internal pelvis, where we ended on the last lab. So here, and just remember that I have a male specimen, so some of these will be specific to the male, and so I'll try and point those out as I go along. And inside the pelvis, we started on the last lab with the external iliac arteries. So external iliac is here, and external iliac is here, coming off of that aorta. So now today we're going to move on to the internal iliac arteries. So you can see internal iliac arteries are here and here. So again, you'll have a left and a right. And so we're going to follow the internal iliac artery, and we'll do that on both sides. But first of all, you're going to cut your pelvis so that you'll be able to see things for when we get to the genitalia and follow these arteries. So I'm just going to talk a little bit about that, and we're actually going to turn it over to the left side of the pony. And on the left side, recall that your limb has been removed, so you don't have a limb in the way on this side, but you're going to actually reflect or remove part of your pelvis. So you're going to do that by cutting with a bone saw, and you're going to cut just ventral here. So you're going to make a cut just ventral to the wing of the ilium here, and then you're going to cut on the pelvic symphysis. So you have to kind of make a path, I guess I would say. So you want to take out some of this muscle that's on the ventral midline here, and you're going to remove some of that muscle so you can see this ventral midline of the pelvis, so the pelvic symphysis. And you're going to actually just push all of the reproductive parts over to the right side so they stay with the right limb. So you're going to just kind of push everything over to the right, take out some of that muscle, use the bone saw, and you're going to cut all the way through that pelvic symphysis. So from here all the way back to here. So that whole thing needs to be cut through, and then you're going to make this cut ventral to the ilium here, and you're actually going to just remove this whole piece of pelvis. And so I'm leaving mine attached. If you can leave it attached, I would recommend doing that so that you can see some of the arteries and things still going where they should be going. But if you don't, you can just remove it and take it off completely. So you're taking off that part of the pelvis. And now we'll go back inside the pelvis, and I'll talk a little bit more about that internal iliac artery and where it's going. So you want to try to follow these arteries on both left and right sides. On the left side, some of them you won't have the whole artery, you'll just have part of it because that side has been cut away. But on the right side, you should have the whole artery, and you should be able to find the whole thing. So on the left side, we're going to start with the left internal iliac artery. So here we have left internal iliac artery, and that is going to branch into two parts. So you'll have an internal pudendal, which will be this branch here. So I'm going to put that in the forceps, and then you can see this other part is going to be your caudal gluteal artery. So it's very large and very thick. So this is all caudal gluteal here coming off. So again, your internal iliac is going to break into two parts. So your internal iliac is only this short little part here. So internal iliac gives off internal pudendal and caudal gluteal. Now the internal pudendal, you're going to follow that and look for the branches that come off of internal pudendal. And the first one is going to be the umbilical artery. And it won't look like an artery. It will kind of look like a nerve. So you want to look for that, and that's the umbilical artery that's going toward the bladder. So the urinary bladder is here. So you can see urinary bladder here, and we have that umbilical artery right there, going right into that bladder. So that's the umbilical artery. Then the next one you want to look for off of internal pudendal is going to be kind of hard to see, so I'll try and turn it a little bit here. So internal pudendal gave off the umbilical, which I'm holding here with my finger, and then continues on, and it's going to give off a urogenital. And so you can see that here, and I'm going to turn it to the lateral side in just a moment to get a better look at that. But urogenital will come off, so in particular in the male, it's going to be called a prostatic artery. In the female, it would be different, so you want to make sure you look at that. And then you have the continuation of internal pudendal. So that's going to continue. So I'm going to turn this to the lateral side so we can look at it from the left view where we cut away that pelvis. All right, so here in this view, we've removed this part of the pelvis, and you can look and see the internal pudendal artery is right here coming out. And so we're looking at internal pudendal here, giving off that urogenital branch. So in the male, again, it's prostatic. In the female, it'll be vaginal. And so prostatic here, and then internal pudendal will continue on. So that's going out to the perineum region out here. So that's then going outside of the pelvis. So if I put this back, you can see how it's coming out of the pelvis and then going into that perineum. So that's internal pudendal artery. Then we'll go back inside the pelvis and look at the caudal gluteal. All right, inside the pelvis, you have all of this is going to be caudal gluteal artery. And then caudal gluteal artery will give off several branches, but we're going to look specifically at the cranial gluteal and then the continuation of where caudal gluteal goes. So cranial gluteal is going to come off, and it's this very large branch here coming off of caudal gluteal. And so cranial gluteal is very large, going out to the lateral side, and we'll look at that in just a moment. And then caudal gluteal is continuing on here. So with the cranial gluteal, I'm going to put my forceps around it and then flip it over to the other side. So here you can see the forceps, and so those are surrounding that cranial gluteal artery. So you should have found that before coming out here on the lateral side. So that's all cranial gluteal. But your cranial gluteal is also going to give off a special artery in the horse, and that's called the obturator artery. So you can see that here. So the obturator artery is coming off right here, and that's going to go through the obturator foramen of the pelvis. So that's what I'm holding in my hand, is that hemipelvis, that part of the pelvis we took off. So you have obturator artery here, and then disappearing underneath this internal obturator muscle. So internal obturator muscle there, covering that obturator foramen, and the obturator artery is going through that foramen. You also have an obturator nerve going through the foramen as well. So here you have obturator nerve running right alongside your obturator artery, going through the obturator foramen. Then the continuation of the caudal gluteal is also seen from the lateral side. And you have your sacrosciatic ligament here, and I've cut through that so I could see where that caudal gluteal artery was coming out. So this is the continuation of caudal gluteal coming out here. So caudal gluteal will continue out laterally, and it actually just punches right through that sacrosciatic ligament. So caudal gluteal there, cranial gluteal was here. The other thing I want to point out is the sciatic nerve. So you have just a stump of the sciatic nerve on this side that you can see here. But you also want to see where it's coming from inside the pelvis, so internally. So when you go back into the pelvis, you want to dig dorsally, kind of by where your caudal gluteal artery is. And I'll just surround it here. So between the end of my probe and the end of the forceps, you can see the sciatic nerve is the root of the sciatic nerve there coming out. Now we'll do these same arteries on the other side, on the right side, so I'll just walk through those quickly. On the right side, internally, you would have the internal iliac artery. Then you would have your internal pudendal. And your caudal gluteal. So caudal gluteal here, internal pudendal here. Then your internal pudendal is the one that gives off your umbilical that doesn't look like an artery. So umbilical artery here going to the bladder again, which is here. So bladder, umbilical artery. Internal pudendal will continue on. And hopefully we can maybe see a little bit of that from the other side that we moved the pelvis, so we can see that. So it's a little bit different view since we're looking at the right side and we're looking at it through the left side, but you can see that internal pudendal artery would be here. So internal pudendal artery here, giving off that urogenital. So in this one it would be prostatic since it's a male. And then internal pudendal will then continue on again and come out caudally in the perineum. Then your caudal gluteal will do the same thing as it did on the other side. And you'll have caudal gluteal giving off cranial gluteal. So here I've cut some veins that were in the way, and you can feel free to do that if you need to see what you need to see. And so here we have caudal gluteal coming off. We have cranial gluteal, if I can get that vein out of the way. Cranial gluteal would be here, going through to the lateral side. Caudal gluteal continues on, and we can see those again on the lateral side, on the right side this time. So here you can see that cranial gluteal coming out on the right side, caudal gluteal coming through that sacrosciatic ligament here. And then you also have your sciatic nerve right here. And from internally, the sciatic nerve root may be easier to see on this side possibly. I think we may have to just take a closer look at that internal pelvis to see that sciatic nerve so I can point that out. This pony is a male pony, and so we're going to talk about the male genitalia for this lab. This pony, however, was not very sexually mature, so a lot of the things are not very visible. So in this region, I'll point out what I can, and I'll tell you where things are supposed to be, and do the best that I can with what we've got to work with here. So internally, when we're looking inside the pelvis, before we move to the external genitalia, we want to make sure and see the ductus deferens. So here we're inside the pelvis, that vaginal ring locale where it would go through the deep inguinal ring is here. So vaginal ring, deep inguinal ring, where it's going through. You have ductus deferens is right here. Then you would also have a testicular artery and vein, which are not injected in this specimen, but would have been here. So that testicular artery typically comes off of the aorta. So you would maybe want to try to find that. It's also very small, so it's easily broken. But you would have a testicular artery and vein, and that's running alongside your ductus deferens, going through that inguinal canal, and then we move to the external features here. So we'll go to the lateral side on the left for this guy. And again, we've already talked about this, but this would be the superficial inguinal ring here, where this is coming out of the external abdominal oblique aponeurosis. So that's traveled through the inguinal canal from inside the abdomen to outside the abdomen. And now we're looking at the cremaster muscle, which is the muscle coming off the caudal edge of internal abdominal oblique. And we have our tiny little testicle here. So I've cut open what would be the vaginal tunic and the spermatic fascia here, and opened that up so we can look at some of these structures inside. So you want to make sure and incise that. So you would have the internal spermatic fascia and also the parietal vaginal tunic that you're cutting through here to get into that cavity to see the testicle. So in here we would have parietal vaginal tunic, and then we also have a visceral vaginal tunic. And so that's what's applied very closely to the testis here. And so that's what makes it look shiny, is the visceral vaginal tunic. Then we also have connecting parts that we need to name, and those are the mesorchium and the mesoductus deferens. So here, you can see the ductus deferens right here in the forceps is ductus deferens, and that connecting part here of that membrane would be the mesoductus deferens. Then over here, you would have your testicular artery and vein here in the forceps, and the connecting part for that then would be the mesorchium here. So mesorchium, and you name it by where it's attaching. So mesorchium is attaching to the testicular artery and vein. Mesoductus deferens is attaching to the ductus deferens. So those are the two connecting parts that you should know. Then on the testis itself, you want to look at the epididymis. So the epididymis is here. And we have a head of the epididymis, the body of the epididymis, and the tail of the epididymis. And so on the lateral side, this is the lateral side, we're on the left side of the pony. So on the lateral side, you have a testicular bursa, which would be right here under the epididymis. So the head of the epididymis is always pointing towards the animal's head. So for orientation, that would be toward the head. Body is in the middle, and the tail is always going caudally towards the tail. So that should help you to be able to differentiate a left from a right testicle if you were looking at one. And the testicular bursa is always on the lateral side. Now on the medial side, you find where the tail of the epididymis is wrapping around and then is continuing as the ductus deferens. So we saw ductus deferens before, but here's where the tail of the epididymis then becomes ductus deferens here. And your testicular artery and vein, if you have injection, it would be good to look at that and see that pampiniform plexus. But in mine, I don't have any injection. But the pampiniform plexus is part of the testicular vein that would be here. And that's that kind of networking, big branching of veins in that area. And then the artery would be snaking through that. And that's where that heat transfer is happening. All right, so then after that, we'll talk about the penis a little bit here. So after the testicle, hopefully you have a better example than I do. And we do have other tissues that you can look at if you don't have a good example. I'm going to turn the specimen over so that we're looking from a caudal view, and we can look at the crura of the penis. So here would be midline, so ventral midline here. And we have a crura, or a crus, on each side. So the crura, left and right, so a left crus and a right crus that are attaching the base of the penis to the ischial arch. So that's where it's attaching to the pelvis. And that crus has the ischiocavernosus muscle, so that's the muscle part that you're seeing from the outside here, from the exterior. And then I've cut open one of these to see the inside, so the interior. So we have ischiocavernosus muscle that's lining the exterior, and then inside we have the corpus cavernosum erectile tissue. So that's this funny looking tissue you see here, right here, with all the holes in it. So that's erectile tissue, and that's corpus cavernosum, and that is surrounded by this thick white lining here, that tunica albuginea is what that's called. So tunica albuginea surrounds corpus cavernosum erectile tissue, and then that is covered by ischiocavernosus muscle, and that makes up the crus on left and right sides, so you have two of those. Then in the middle, so we're looking at the what would be called the root of the penis, and so we have the root of the penis would be here, and you have between your crura the root, and you also have the bulb. So the root is where it's attaching, bulb would be here, and then once those crura come together, you're forming the body of the penis here. So root, bulb, body is continuing on. And in this region, we're going to have the corpus spongiosum, erectile tissue. So that's inside, corpus spongiosum. And then on the outside, exterior, covering that would be the bulbospongiosus muscle. So bulbospongiosus muscle, corpus spongiosum, erectile tissue inside. Then also in this region, you want to be careful not to cut this, but this is your retractor penis muscle that we talked about in the previous lab. And retractor penis, it looks kind of white because it's smooth muscle, and that's extending down the midline here, the ventral aspect of the penis. So retractor penis there. Then you want to look at the body of the penis and then make a transverse cut as well so that you can see inside and see how those erectile tissues are set up. So here again, we're looking mainly at the corpus spongiosum, and then we would have your urethra would be the hole right here. So urethra there, corpus spongiosum here. Then we'll move down and take a look at another transection as we move further distally. So here we would have the body of the penis, and then we have the free part. And so we'll get to that after the body. So body would be here, and here I've made a transection again to look at those different erectile tissues. And I can try and make those visible here. So there's a good image in your lab guide that would be helpful here, but I just want to point these out. So when you make this transection, try not to cut through your retractor penis muscle, and also be careful dorsally because of the nerves and arteries there. And so here you would have urethra as a little hole in the middle. You have your corpus spongiosum erectile tissue. It would have bulbospongiosus muscle surrounding outside. Then we have corpus cavernosum erectile tissue here. And then you can see that tunica albuginea is that thick white line that's surrounding those. All right, the other thing I want to point out while we're in this region is the dorsal nerve of the penis that comes from the pudendal nerve. And so here you can see I have pudendal nerve coming out alongside an internal pudendal artery that's kind of that branch got cut that was there. But internal pudendal artery comes out alongside pudendal nerve, and the pudendal nerve then gives off this dorsal nerve of the penis here. So you want to find that. And you'll have a lot of veins in this area typically, so sometimes you'll have to cut through those, but you want to look for that dorsal nerve of the penis. Then we'll move on and talk about the free part and the prepuce a little bit here. So the free part of the penis would obviously be here, and your prepuce has been kind of mainly taken off, but you have some of the prepuces here. You would have your preputial orifice would be right here, and that's kind of where that hairy skin is ending. So preputial orifice. Then you have this ridge, that's the preputial ring. Your glans penis would be the distal end, so here would be glans penis here. And your glans penis will contain corpus spongiosum glandis, which is another erectile tissue. We also want to look at the urethral process, so that's going to be this little protrusion at the tip. So urethral process, and that's surrounded by the fossa glandis. So fossa glandis is surrounding that urethral process. And fossa glandis will have a little urethral sinus, so that's why I've opened this up with an incision. So you have your urethral process was here, that little protrusion. Your fossa glandis is the dip that goes around it. And then the urethral sinus is another little indentation here in the fossa glandis. So urethral sinus would be dorsal in the fossa glandis. So hopefully you have, again, a better specimen than I do. So right there, urethral sinus. Fossa glandis is kind of a little moat surrounding the urethral process. Now we'll move on and take a look, again, inside the pelvis, but from the lateral side where we've removed our hemipelvis. And so, again, this is going to be harder to see in this specimen because it's not a very developed male, but I'll try and show you what I can. So mostly we're seeing bladder right here. And I'm going to try and show you some of the parts of the male tract that's inside the pelvis. So here, from the left side, you would have a ductus deferens. So this is ductus deferens here. You have another ductus deferens on the other side, the right side. So other ductus deferens is here. In between those two, here if I just, right here. Here would be ductus deferens here. And then on the other side, ductus deferens is here. And this fold, kind of going in between the two, is the genital fold. So you want to look for that in between your two ductus deferens. And then we'll go back over here. So push that bladder out of the way. And so back on the left side here, we have the ductus deferens. And if you had a mature male, you would have an enlargement here that would be called the ampulla. And so the ampulla should be here. Then you would have your vesicular gland. So this is on both, you have this on both left and right sides. I'm just looking at one side. So you would have ampulla here and also on the right. Here you would have a vesicular gland, kind of a little sac-like structure, but this one is not, again, very developed, so it's very small, hard to see. But vesicular gland on both left and right sides. Then you would have your prostate gland, which kind of has little, almost like wings to it, but this is, again, not very developed, so it's very small. This would be prostate. Then you move further along caudally, and you would have your urethralis muscle, which is kind of the muscle you're seeing here. And then you would also have the bulbourethral glands, which I don't really have an example of on this guy. But they would be back in this region. So you would have bulbourethral gland here, kind of at that ischial arch area. And then here obviously is your crus of the penis.